Hello everybody, my name is Andrew McClendon, and the topic that I was assigned for this project was quality improvement in healthcare. So, fortunately for me, this class happened to fall during a time period for Atrius Health where they announced a major partnership with Blue Cross Blue Shield. The meeting was held at the Edward Kennedy Center in Boston in front of a crowd of roughly 400 people. Also, luckily for me, the sole purpose behind this partnership, other than financial growth, was quality improvement for the organization as a whole. The only reason I even got to attend this meeting is because my mother has worked for Vanguard, Harvard Pilgrim Health, and Atrius Health, which is the same company, for over 30 years, since its conception, actually. And she, along with many other nurse leaders from all over the organization, were invited to serve on the board that came to this decision, so that nurses, who are a huge part of the organization, may have some input, have a voice, and basically oversee every step of this process. The partnership drastically affected the 600 plus nurses and APCs employed by Atrius Health. One of the big reasons that nurses were so concerned was because with all the changes in government and everything recently, the Affordable Care Act, the profits for Atrius Health as a whole, especially in 2015 and 2016, which I was actually with the company at the time, they operated at huge losses both of those years. And for the first time in the history of the organization, they were actually forced to lay off nurses. Mostly in the case management department, but any layoffs for nurses was just shocking and unexpected for them. So a big part of what they were doing was they were making sure that their best interests were represented, and making sure that they would not suffer any more job losses or anything of that nature. So, by the end of this presentation, I'm hoping that everybody will be able to describe how this strategic partnership with Blue Cross and Blue Shield will describe it in general, and also how it relates to quality improvement for Atrius Health as an organization. I also hope that the student will be able to describe how this partnership will affect and improve the daily work life of RNs and APCs, while still keeping care improvement in the forefront as a goal, and utilize it moving forward as effectively as possible. So, the topic of quality improvement, especially related to nursing, and the topic that I chose, it really related to multiple of the related course outcomes. So I had to choose four. The four that I thought really kind of, I guess, aligned the best with it. The first one I chose was discuss healthcare economics and financial management of healthcare services. I mean, a major merger like this, or a merger partnership like this, really, this just encompasses that in general. You have a company that was struggling financially for a couple of years, and the healthcare economics behind it is they needed a partnership to stay viable. The next one, discuss current issues affecting the American healthcare systems. To me, that really showed up in this situation too, because you had a company that was financially viable since its inception, and all of a sudden, with the changes in government, they got an influx of patients. The Affordable Care Act really gave them an influx of patients, which is seemingly good, but it also lowered the rates at which they were reimbursed for everything. And they still had to provide the same quality care. So providing the same quality care to more people while getting less money from the people you're already serving, and even less money from from a lot of the new people who are being accepted into the practice. It made it very difficult to come up with a model of sustainability moving forward. The next one was describe methods of quality improvement for healthcare systems and outline a quality improvement plan within a healthcare environment. So, this whole project that I've put together here is basically describing a method of quality improvement for a healthcare system. The big thing for this partnership was they wanted to secure capital gains. They needed more money so they could keep growing financially and as a practice. But they were not willing to do so if it affected the quality of the care that they were providing. They were adamant about this. They had many different options as far as this went. Blue Cross Blue Shield really checked all the boxes that they were looking for. This particular partnership really, to me, aligned with that course outcome. And the last one, evaluate a budget proposal in relation to quality improvement initiative. This whole project is about exactly that. So you will see that. Okay, so I want to touch on how this was big for nursing leadership. So obviously, as I stated earlier, for the first time ever in the history of Atrius Health, they had to make layoffs in 2015 and 2016. They lost tens of millions of dollars in both those years. It was getting to the point where they were concerned that they would have to be absorbed by another bigger company, or they would have to just close their doors altogether. Because no one can operate at those type of losses for any sustained period of time. So the nursing leadership was obviously concerned about a major financial decision like this. So they had many nursing leaders from all over the practice, which spans all over Massachusetts, and they were very well represented at all of these meetings. And they had a loud voice, which was heard by the doctors, the administrators, all the way up to the CEO, and their voice was taken into account. Nurses are unionized with Atrius and therefore are on their own contract. So making sure that they had a voice in these negotiations to represent their own best interests was essential for nursing leadership. They couldn't just assume that everything that went for everybody else also went for them. They're on their own contract. They had to make sure that they were fighting for what they felt that they deserved. The things that were a focal point from a nursing perspective were increases in nursing staffing, which, as I stated before, had been down because of the financial hardships. They wanted an immediate new contract with increased wages. So this proposal was announced on February 10th, and they are already in negotiations for a new contract with increased wages. And according to my mom, they are making substantial progress already. Um, Gaining a major partner like Blue Cross Blue Shield definitely goes a long way in securing capital towards making something like that happen. They wanted new and updated equipment and exam rooms that they use on a daily basis. So, with the financial hardships that they had been going through, supplies weren't always as readily available as they should have been. They were, like old offices, things like that have been converted into exam rooms. And, money was being saved where it could, but it's, a lot of times it was at the expense of nurses, which, really wasn't fair because they are the first ones the patients see when they come in to be triaged. They're also the first ones who they'll talk to on the phone if, other than the medical secretaries, if they're worried that something's going on, the nurse will come on and they will triage the patients. So, the first ones seeing the patients, the first ones really talking to the patients, they felt that they deserved better, and, rightfully so. They also wanted better and more training for both new nurses with the organization, as well as currently employed nurses. More resources for continuing education and seeking higher degrees. So obviously training new nurses was huge for them. They wanted them to get the best training available, the most up-to-date resources, but they also wanted to make sure that their current nurses were keeping up to date and that they were receiving the support and attention that they needed as well. So working directly with a major insurance company also helps nurses by eliminating a lot of the common roadblocks they previously ran into, such as getting hospital referrals that go through insurance, getting prior authorizations passed through insurance. A lot of that workflow was eliminated with Blue Cross Blue Shield due to this partnership, which is a huge time saver for the nurses and the nurses. This was a largely democratic leadership style that was exhibited by the higher-ups that were involved in this decision process. They really took into account what nurses had to say here. They really wanted to know what they needed, and they wanted to know, how they could get that for them. All right. So as I said, I touched upon in 2015 the financial hardships and how nurses actually had to be laid off for the first time in the history of the company. This greatly affected patient care because, lower nurses, the same amount of patients, led to delays in being triaged over the phone as well as in the office. They do these Press-Ganey reviews, and it really showed up heavily in those. A lot of patients were dissatisfied in the delays in cares that they received. And, all the nurses were dissatisfied in being short-staffed and, having to run ragged every shift to, accomplish the same amount of work that they used to have more people to accomplish. So when combined with changes in government and the Atria switch from an HMO to a PPO, they saw a large population of patients seeking other healthcare providers who could provide the same services at a competitive or better rate. The difference between Atrius and other organizations was that Atrius was an independent organization, and they weren't an entity of a hospital or anything like that. So they found, the switch from an HMO to a PPO to be a lot more devastating than a lot of other places might have. So this new partnership, what it does is it greatly increases both the clinical resource as well as the capital resources of Atrius Health. So, the idea is definitely to decrease the delays in care, and it should do that immediately. It increases the resource available to patients and ultimately helps the patients save money, and no one's going to argue with that. This is a direct quote from an article that I read, basically, summarizing the partnership, which said the key will be keeping patients out of the most expensive setting, a hospital. That's a common goal for patients, doctors, nurses, and insurers, but not so easy for the estimated 5% of patients who represent 50% of healthcare spending, obviously the more high-risk patients. With this contract, Atrius will have a large pot of money to spend on preventing illness and injuries that land patients in the hospital. And that's ultimately always the goal for a healthcare provider. So the role and functions of the nurse leader. During these negotiations, nursing leaders from all over Atrius, as well as a heavy representation from nursing leaders from MNA, they were heavily involved in protecting the nurses employed by Atrius, making sure their voices were heard in the process, which, as I said before, it was heard very loudly. The democratic style implemented by the top executives gave them their voice. And their concerns related to loss of jobs, subpar staffing, better wages, and lack of access to necessary resources were heard and are already being negotiated and ratified as we speak, which, to someone whose mother is directly involved in this situation, they could not be happier. This is a huge victory for them. The nursing leaders fought extremely hard to not only stop staffing cuts, but to add significantly more nurses to the company, which will help handle the increased volume of patients that this partnership will bring. This merger it's an estimated financial resource. It's adding an estimated 60,000 patients, at least financially. Which the amount of money that they would need to cover the 60,000 patients is an astronomical amount. So this is a huge deal for them. The increases in staffing and resources will be essential in saving the company and the patient's money on unnecessary hospital admission due to delays in care. It's a trickle-down effect. If the nurses are able to attend to the patients in a more timely manner, then the patients will receive better care, and they will not need to seek unnecessary hospital admissions. Just a couple of everyday examples. This quote is from Andrew Dreyfus, the CEO of Blue Cross Blue Shield, who also had a huge hand in this. To the extent that Atrius Health can better manage the patient's care, better coordinate it, keep people out of the hospitals when they don't need to, keep them out of the emergency departments, there's an opportunity to save millions of dollars, which can be reinvested in caring better for the patients, which is a huge organizational goal. This was just an example from the article that I previously stated, kind of broke down the partnership. Take, for example, a patient with diabetes. Atrius might use an in-house pharmacist to manage the sometimes complicated array of medications and avoid complications that trigger a hospital admission. In pediatrics, Atrius will expand a program for children with complicated conditions, where a care manager makes sure they get into appropriate programs or make appointments with the right range of specialists. In mental health and addiction treatment, Atrius Health plans to hire more providers and subsidize the standard payments. Atrius says underlying behavioral health conditions increase a patient's healthcare costs 2 to 7-fold. Just a video here for you guys to watch at your leisure. It is the CEO of Harvard Vanguard and Atrius Health. He speaks about the partnership with Blue Cross Blue Shield, and it really is it's like a breath of fresh air, really, because it's a huge victory for nurses and for this healthcare organization. So in conclusion, Atrius needed a new plan to stay financially solvent in a rapidly changing healthcare landscape that brought them to the brink of disaster only 2 years ago. In utilizing a democratic leadership style, Atrius Health carefully selected a board of 80 physicians, many nursing leaders, and administrators to have a voice in deciding the future of this company. Atrius agreed to a strategic partnership with with Blue Cross Blue Shield, which allows them to secure capital for growth and utilize the resources of Blue Cross, while still sticking to their mission of providing high quality and value-based care to all of their patients. Nursing leaders had heavy involvement in this process, and they saw all of their demands met, and more regarding this partnership. This was a huge victory for the nurses of Atrius Health, who were victims of budget cuts only 2 short years ago. Thank you very much for listening to my project on quality improvement in healthcare, especially as it related to nursing. Any questions, feel free to ask. Thank you guys so much.